Dr. David Amaron, I want to talk about something very important, and this has to do with the skin actually, and proper liposuction technique. I've been told so many times that Dr. Mooney gets such a smooth result with how you go about doing liposuction. The skin has a perfectly even result to it. And a lot has to do with primarily just great liposuction technique. It's less about what tools you're using and proper technique. And I want to talk about this just very quickly. I do this primarily avoiding general anesthesia for a number of reasons. Safety, recovery, primarily results, and because liposuction under general anesthesia is a technical disadvantage. You're lying there, being rolled around, loose muscle tone, but it puts a surgeon at a technical disadvantage because they can never really perfectly be in the right plane. And remember, liposuction is about being in that proper plane between the skin and muscle, the subcutaneous layer. If this blue towel represents a muscle and this white towel represents the skin, it is staying perfectly in that layer of fat all the time, being parallel to that surface of the skin and never disrespecting the skin from underneath. So a lot of it has to do with the position of the patient tightening their muscles up, myself, my technician, perfectly spreading that skin out and retracting it like a tight sheet with no wrinkles in it. And then I start doing my liposuction. So if I'm using a tool, a cannula under the skin, it's always about gliding. If you watch my surgeries, you're watching and seeing that I'm never jabbing the skin from underneath. Many surgeons will grab the skin, they'll disrespect the skin, and that disrespect from the skin underneath irritates the underneath part of the skin called the dermis, and you get uneven retraction of the skin, uneven pullback of the skin. So the main reason when I do all this revision work, the main problem that can occur if the surgeon has not done it properly and disrespected that skin is you get uneven pullback of the skin. The skin is not laid down flat and even. And it's more about proper technique, always being that layer, especially as you bring that layer, making that layer thinner and thinner, and always respecting the skin. Very, very important.